Memory loss, particularly recent memory, often serves as one of the first noticeable signs of cognitive decline. Individuals may find it increasingly difficult to recall new information, such as names of acquaintances they just met or details of recent events. This isn't simply forgetting where the keys were left. It can extend to moments that should be easily retrievable, like what was discussed during a family dinner the night before. As this memory loss progresses, it may become frustrating for both the individual and their loved ones. Conversations may feel disjointed as the person struggles to piece together thoughts or memories. Friends and family might notice that the individual frequently asks the same questions or tells the same stories, not realizing they've just done so. This can create a cycle of embarrassment and anxiety for the affected person, as they grapple with their fading recollections. Moreover, this memory impairment can lead to a decline in independence. Tasks that once required little thought might now demand significant mental effort. Activities that stimulate the mind, like reading, might also be put aside, further exacerbating the issue. Engaging in discussions about recent news or events can become burdensome, causing the individual to withdraw from social interactions. It's important to recognize that this isn't just a normal part of aging. While occasional forgetfulness is common, consistent and progressive memory loss can be a warning sign. Family members should be attentive and compassionate, offering support while encouraging the individual to seek professional help if the situation worsens. In summary, recent memory loss is a critical indicator of cognitive health. Understanding its implications can help prompt early intervention and support, making it easier for those affected to navigate their daily lives. Individuals experiencing cognitive decline often find themselves struggling with daily tasks that were once second nature. Cooking a familiar recipe may suddenly feel daunting, with the individual unsure of the steps or ingredients required. This can lead to frustration and a sense of inadequacy, as they might feel that they are losing a fundamental part of their identity, being able to care for themselves and others through simple acts like cooking. Managing finances can also become a source of anxiety. Tasks such as balancing a checkbook or remembering to pay bills on time may slip through the cracks, leading to potential financial issues. This can be particularly alarming, not just for the individual but also for family members who may need to step in to help manage these responsibilities. As cognitive function declines, organizing daily schedules can become increasingly challenging. Individuals may forget appointments or struggle to remember commitments, disrupting their routines. This can further contribute to feelings of frustration and helplessness, as they grapple with a loss of control over their lives. Family and friends can play a crucial role in this scenario by stepping in to assist without overwhelming the individual. Offering to help with grocery shopping or bill payments can alleviate some of the stress associated with these tasks. Encouraging the use of reminders or lists can also provide a sense of structure and support. Recognizing these difficulties is essential for early intervention. By addressing these challenges with empathy and understanding, families can help their loved ones maintain a sense of dignity and independence, even as they navigate the complexities of cognitive decline. Temporal and spatial disorientation can manifest in several ways, often leaving individuals feeling confused and anxious. People might lose track of time, struggling to remember what day it is or the current season. For instance, someone may wear a heavy jacket in the middle of summer, believing it's still winter, which can be alarming not just for them but also for those around them. This confusion can extend to physical spaces as well. An individual might find themselves lost in familiar neighborhoods or unable to recognize landmarks that were once easily identifiable. This disorientation can lead to feelings of helplessness, causing individuals to avoid leaving their homes altogether, which can further isolate them from social interactions. Family members may notice these signs and feel a sense of urgency to intervene. Encouraging the individual to carry identification or a cell phone can provide a sense of security when they venture outside. Additionally, creating a safe and familiar environment at home can help ease some of the confusion associated with spatial disorientation. In certain cases, this disorientation may also result in risky behaviors, such as wandering away from home without a clear understanding of where they are going. It's crucial for family members to remain vigilant and proactive in ensuring the safety of their loved ones. Ultimately, recognizing the signs of temporal and spatial disorientation is vital for fostering an environment of support. Open communication and understanding can empower individuals to seek help, ensuring they remain connected to their surroundings and loved ones as they navigate the challenges of cognitive decline. Changes in mood and behavior can be subtle at first but may escalate over time. It's quite common for individuals to experience moments of irritability or sadness, but when these shifts become more pronounced, it's worth paying attention. For instance, someone who was once cheerful and engaging might suddenly seem withdrawn or indifferent. This kind of emotional volatility can affect relationships and daily interactions, leading to isolation. Understanding that these changes are not simply a phase but potentially a warning sign can encourage early intervention. Apathy is another significant indicator of cognitive decline. When individuals lose interest in activities they once enjoyed, it may signal underlying issues. Imagine a person who used to love gardening suddenly neglecting their plants, or a once passionate reader abandoning books altogether. These behaviors often stem from a deeper emotional struggle that might be linked to cognitive challenges. Recognizing this apathy is crucial, as it often requires gentle encouragement and support from loved ones. Depression and anxiety can also manifest alongside cognitive impairment. The interplay between mood disorders and cognitive decline is complex and cyclical. Individuals may feel anxious about their memory loss, leading to a downward spiral of depressive symptoms. This duality can make it difficult for family and friends to understand the root cause of the changes they observe. It's essential for caregivers to approach these situations with empathy and to seek professional guidance when necessary. Being aware of these mood changes can also help in identifying the need for medical evaluation. Healthcare professionals can provide appropriate assessments and interventions. Early detection is key, as it can lead to more effective treatment options and better management of symptoms. This is particularly important because many mood disorders are treatable, which can significantly improve quality of life. Lastly, social support plays a vital role in managing mood and behavior changes. Engaging with community resources, support groups, and mental health professionals can provide essential assistance. Encouraging open conversations about feelings and experiences can help diminish the stigma surrounding mental health issues, fostering an environment where individuals feel safe to express their struggles without fear of judgment. Communication difficulties can be one of the most distressing signs of cognitive decline. Individuals may find themselves struggling to find the right words during conversations, leading to frustration and embarrassment. This can manifest as pauses in speech or substituting words with incorrect ones, making interactions challenging. For family members and friends, these changes can be puzzling and concerning, emphasizing the importance of patience and understanding during discussions. Repetition is another common issue faced by those experiencing cognitive decline. Someone may ask the same question multiple times within a short span, not realizing they've already received an answer. This can create tension, as caregivers may feel tested by the need to repeatedly provide the same information. Recognizing this behavior as a symptom rather than a willful disregard can help in approaching the situation with compassion and support. Following conversations can also become increasingly difficult. Individuals may struggle to keep up with the flow of dialogue, missing key points or losing track of the topic at hand. This can lead to feelings of inadequacy and withdrawal from social situations. Encouraging a slower pace in conversations and using visual aids or written notes can help facilitate better communication and understanding. It's essential to create an environment conducive to effective communication. Reducing background noise, maintaining eye contact, and using clear, simple language can significantly enhance understanding. Family members can also benefit from learning about communication strategies tailored for individuals with cognitive challenges. This proactive approach can foster a more supportive atmosphere, allowing for meaningful interactions. Seeking professional help for communication difficulties is also a valuable step. Speech-language therapists can provide targeted exercises and strategies to improve communication skills. These professionals can work with both the individual experiencing difficulties and their loved ones, equipping them with tools to enhance interactions. Ultimately, addressing communication challenges early on can greatly improve the overall quality of life and strengthen relationships. As individuals age, it's common for them to experience shifts in their interests. However, when someone begins to lose enjoyment in hobbies or activities they once cherished, it can be a significant red flag. For instance, a passionate gardener may suddenly neglect their plants, or a devoted reader might find themselves unable to pick up a book. This decline in engagement can stem from various factors, including cognitive decline or emotional struggles. When this loss of interest becomes pronounced, it may affect social interactions as well. Friends and family might notice that their loved one is withdrawing from gatherings or avoiding events they used to look forward to. This withdrawal can create a cycle of isolation, leading to further emotional distress. It's essential to pay attention to these changes, as they can indicate deeper issues that may require intervention. Moreover, the loss of interest doesn't solely pertain to hobbies. It can also extend to daily routines and responsibilities. Individuals might start neglecting personal care or household tasks. This shift in behavior can signify a struggle with motivation, which is often intertwined with cognitive health. Recognizing these changes early can provide opportunities for support and engagement. If someone you know is showing signs of losing interest, it's crucial to approach the situation with empathy and understanding. Encouraging them to participate in activities, even in small ways, can help rekindle their passion. Sometimes, simply being present and sharing experiences can make a world of difference. Engaging in conversations about their feelings and interests can also be beneficial. This dialogue allows individuals to express what they're experiencing, potentially unveiling underlying issues that may need addressing. By fostering an open environment, you can help them reconnect with what once brought them joy. Impaired judgment manifests in various ways and can be particularly concerning in everyday situations. When someone begins to make poor decisions, like investing in dubious schemes or neglecting their health, it raises alarms about their cognitive functioning. This lack of sound judgment can stem from various factors, including cognitive decline, leading to serious consequences in their lives. Family members may notice that their loved one struggles with basic decision-making tasks, such as managing finances or planning meals. For example, they might forget to pay bills on time, leading to financial penalties or even loss of services. These lapses in judgment can create a cascade of problems, affecting not just the individual but also their loved ones who may need to step in and help. Additionally, impaired judgment can lead to risky behaviors that endanger personal safety. Individuals may disregard warnings or engage in activities that put them at risk, such as driving recklessly or ignoring health advice. This behavior can be alarming for friends and family members who want to ensure their safety and well-being. Recognizing these signs early is crucial for effective intervention. Open conversations about observed behaviors can create a supportive environment where individuals feel comfortable discussing their struggles. Encouraging them to seek professional help may also be necessary to evaluate their cognitive health. By addressing impaired judgment promptly, it's possible to implement strategies that promote better decision-making. This might include setting up reminders, seeking assistance with finances, or engaging in activities that promote cognitive health, ultimately helping to mitigate the risks associated with impaired judgment. As we wrap up our exploration of the 7 early signs of Alzheimer's disease, it's crucial to remember that awareness is your first line of defense. Each sign we discussed today, whether it's memory loss, difficulty in planning, or changes in mood, serves as a vital signal from our brain. Have you noticed any of these signs in yourself or a loved one? Remember, early detection can lead to better outcomes, and seeking help is a sign of strength, not weakness. So, what can you do next? Consider talking to your healthcare provider if you or someone you care about is experiencing these symptoms. Don't wait for the signs to escalate. Instead, take proactive steps to enhance brain health, like staying mentally active, eating a balanced diet, and fostering strong social connections. And speaking of connections, how do you keep your brain engaged? Share your tips in the comments below. Let's create a community that supports one another in maintaining cognitive health. Stay curious and informed because knowledge is power. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more insights into your health. Your journey to understanding Alzheimer's starts now.